Hello everyone, my name is Dendra Kisha. We are from Gb It going to present about our web of caution for gastroenteritis, also known as stomach flu. So, at first, I'm gonna explain about the definition of gastroenteritis. Gastroenteritis is an inflammation of the stomach and intestines that results in diarrhea, vomiting, abdominal pain, and dehydration. It can affect anyone, but it is especially common in children. The purpose of this presentation is to explain how different factors are connected in causing gastroenteritis and how this lead to various nursing problems that need to be managed. As shown in our web of caution diagram here, the main problem in the center is gastroenteritis. So, from here we can see the two major branches, pathogenic factors and also toxic factors, which describe the sources and causes of infection. Now, let's move to the first part, the causes and how this disease can spread. The infection can spread through direct contact, such as touching infected individuals, not washing hands properly, or changing diapers without hygiene precaution. It can also spread through contaminated food or water, especially when food is not cooked well. The causes are divided into three main groups, which is viruses such as norovirus, rotavirus, adenovirus, and astrovirus. And there is a bacteria like E. coli, Vibrio cholerae, Campylobacter, and Shigella. And also there is a parasite such as Entamuba histolytica and Cryptosporidium. Besides that, there are also toxic causes including food allergies, spoiled food, or poisoning, or even the side effects of certain medication. When these infectious or toxic agents enter the gastrointestinal tract, they cause inflammation of the intestinal mucosa, which leads to several symptoms. One of the most common is diarrhea, which will be explained further by Corny.
Hello, I'm Kornikova, and I will explain the further pathophysiology of gastroenteritis. Infection causes the disturbance in the digestive tract, preventing the proper absorption of nutrients. As a result, the osmotic pressure within the intestinal lumen increases, triggering the movement of water and electrolytes into the intestine, leading into an excessive amount of intestinal contents. This excess causes an increase in defecation frequency, resulting in diarrhea. So the nursing problem based on NANDA is diarrhea, with the main intervention being diarrhea management. So when diarrhea become prolonged, it can lead to two conditions. First is fluid and electrolyte deficiency. The identified nursing problem is risk for electrolyte imbalance, with the main intervention being electrolyte monitoring. The second is weakness and fatigue. The identified nursing problem is hypovolemia, which refers to an decreased circulating blood volume. The main intervention for this problem is hypovolemia. So, for the next further pathophysiology will be explained by Cinta.
Thank you, Corey, for the explanation. My name is Cinta Cantika. I will explain about the nausea and vomiting. Nausea and vomiting are considered main symptoms of gastroenteritis because they are a fundamental part of the body's response to the infection or irritation in the stomach and intestine. The first is again attacks will divided into two. The first compensatory reaction. There is a fever and chills. Fever and chills are a common bodily response to infection, serving as an attempt to fight the pathogen. The second is body defense mechanism, indicates the presence of an infectious agent like virus, bacteria, or parasite attacking the body, triggering a response from the immune system. The next is eliminating the agent through nausea and vomiting reaction. Nausea and vomiting are interpreted as a bodily defense mechanism to expel or get rid of the disease-causing agent from the digestive tract. The next is appetite will decrease. Nausea and vomiting and the general state of illness cause a reduction in appetite. The The next is inadequate nutritional intake. Decreases appetite and vomiting lead to insufficient nutrient intake into the body. For the nursing diagnosis, the first is risk for deficient nutrition. This is a nursing diagnosis that arises due to inadequate nutritional intake caused by nausea, vomiting, and decreases appetite. For the intervention or nursing actions, eating disorder management involves efforts to reduce nausea and vomiting and make the patient more comfortable so they are willing to eat. The next is nutrition management involves efforts to ensure the patient receive adequate nutrition, for example, by providing small but frequent meals, selecting easily digestive food, or administering appropriate fluids or electrolytes. The next will explain by Rachel.
Okay, thank you Cinta Cantika for your explanation. My name is Rachel Ananda. I will explain for the next explanation. Now, as we can see on the right side of the diagram, cramps or abdominal pain happen because inflammation in the gastrointestinal tract. This inflammation stimulates the nerve endings in the stomach, causing pain and cramping. The nursing diagnosis related to this condition is pain or acute pain. The main intervention here is pain management, which includes monitoring pain levels, helping patients find comfortable position, and administering medication as prescribed. Another important problem in this diagram is knowledge deficit. This usually occurs because the patient or their families lack awareness about hygiene and infection prevention, which can lead up to the bacterial growth and reinfection. Therefore, health education is essential. Nurses should teach proper hand washing techniques, safe food handling, and the importance of maintaining personal hygiene to prevent further spread of the bacteria. Finally, all of this intervention, rehydration, electrolyte balance, nutrition, pain control, and education aim to achieve the desired outcomes: balanced body fluids, normal body temperatures, improved appetite, and complete recovery. In conclusion, the web of caution helps us clearly understand how gastroenteritis develop and how nursing care can effectively prevent complications. Okay, thank you for watching our presentation. See you.
Okay guys, to conclude our presentation, gastroenteritis is a common yet serious condition that can cause significant discomfort and dehydration, especially in children. Through our web of caution, we can clearly see how various pathogenic and toxic factors are connected and how they lead to symptoms such as diarrhea, nausea, vomiting, and abdominal cramps. By understanding this web, nurses can easily identify the root causes, determine the appropriate nursing diagnosis, and plan effective interventions to prevent further complications. Nursing care plays a vital role not only in treating patients but also in educating families about the importance of hygiene, safe and food handling, and proper hydration. We hope that this presentation helps us and others gain a deeper understanding of how gastroenteritis develops, how it can be managed, and most importantly, how it can be prevented through good health practices. As a future nurses, we are encouraged to always look at patients holistically, not just treating patient symptoms, but also addressing the causes and promoting long-term wellness. Lastly, we could like to note that all references used in creating this web of cautions have been properly cited based on incredible and updated nursing literature. So guys, thank you very much for your attention and for watching our presentations. We hope this explanation provides useful insight into understanding gastroenteritis and its nursing management. See you!